Are you confused about the difference between home care and home health services? When people don't understand the differences between home health and home care, this can lead to some issues. They may get the wrong type of home care in place. Their loved one's needs are not going to be met appropriately. And this is going to cause a lot of additional stress and strain on the situation. So, knowing the differences between home health and home care will save you a lot of time and headaches. My name is Jennifer Benjamin, and I am the owner of Family First Home Companions. And today we're going to talk about the important differences between home care and home health care. So, home care, or also known as non medical home care, consists of companion caregivers that come into the home to help with non medical activities. This will include things that are not hands on care. So, for instance, they will help with meal preparation and light housekeeping and help a person get in and out of the shower and get dressed. But they are not going to provide physical lifting and maneuvering and transferring of a person from a bed to a wheelchair, for example. They're not going to be able to lift a person up out of a seated position. They're not going to be able to give a head to toe bed bath for someone who can't walk and get up and walk into a shower, for example. So when we are talking about home health care services, those are companies that do provide that hands-on care. They will typically have nurses in the company that come out to meet with a person at home. They will also have certified home health aides and certified nurses aides that do the hands-on care services. And sometimes they'll also have physical therapy, occupational therapy, and even social work services. So the home healthcare services are very different from home care or non-medical home care services. So when a person is looking to choose between non-medical care or home health care, it really comes down to what their needs are. Do they need those hands-on care services? Those kinds of things are going to really point them to looking at a home healthcare service versus a non-medical home care service. So those are the different services and how they are different between non-medical home care and home health care. Matching is another big difference when you're looking at non-medical care versus home care. With non-medical home care, you are going to get a focus on caregiver matching for companionship. And this is a big focus of non-medical care. We are looking to match caregivers with clients based on personality, qualifications, their background, their experience. Sometimes we're even looking at matching caregivers with clients that have a lot in common. Maybe the caregiver has grandchildren, and a match with a client who also has grandchildren would result in really good companionship. So when you're looking at non-medical home care, remember that companionship is a big component when we're matching caregivers to clients. With home health care, the difference with matching is that a home healthcare company is going to match a caregiver based on their skills. So if a client needs assistance with bathing, for example, they're going to match one of their caregivers who's been trained and specifically has those skills for bathing a person. So skills are more matched to a client's needs in a home healthcare company, not so much focused on matching personality and companionship factors when it comes to a home healthcare company. Another key differentiation is the hours. When it comes to home health, the hours of services are very minimum. You would be typically receiving anywhere from 2 to maybe 4 hours per week. And in those hours, you're only going to be getting a assistance with bath or shower, or maybe it will be a physical therapy visit or an occupational therapy visit. It's going to be a lot more minimal services in a home health care company. Home health is prescribed by a doctor to address specific needs for a person, and those needs are going to get covered in that 2 to 4 hours each week. And that's going to include things like bathing assistance, a visit from a nurse, perhaps a physical therapy service as well. So it's going to be a lot more specific and a lot more limited in terms of hours during the week. Some of the confusion when it comes to the differences between home care and home health is the way it gets paid for. With home care, there's three main ways that home care is paid for. It's either through paying out of pocket, which is what most people do, veterans aid and attendance benefits, or through long-term care insurance. When it comes to home health, it's paid through Medicare. And what it also includes is some requirements. The person had to have been either discharged from the hospital or from a skilled nursing facility. It had to have been prescribed by a doctor, and they have to show that there is a need for home health in the home. It's important to understand the differences, but it's also just as important to understand how they work together. So with Medicare services, they are quite limited. And again, it can be from 2 to 4 hours per week. This is where non-medical home care can come into play. Non-medical care can fill in those gaps when a person needs help at home outside of that 2 to 4 hours that home health is there. We partner with many home health care companies, and they recommend our company because we can come in to provide assistance with the tasks and the time frames that the home health company is not covering. It's also recommended to have both home health and home care services together at the same time, because both companies can complement each other with covering services and needs that a person requires from both agencies. Another great way that they work together is through the physical therapy exercises that home health will prescribe. Home care, when a caregiver is there working with the person who's also getting home health, they will continue to do those exercises together with the client so that that person continues to build up their strength, their stamina, and they stay on track with their physical therapy exercises. And it's also important to note that oftentimes it can take more time to get home health care started versus home care, especially if a person is being discharged from the hospital or a skilled nursing facility. They may need help at home right away as soon as they get home. And home care can typically start within 24 to 48 hours, where a home health care company may not be able to start that quickly. If you're not sure which way to go, if it's going to be home care or home health, visit our website at familyfirsthomecompanions.com to learn more, and we will be happy to answer any questions you may have.